Next question is from William Gilmeister. He says, thanks for everything. You are welcome. Did you not program restoration of your strength after your tonsillectomy beyond planning to do as much of your pre-op program as you could? I get it if you wanted to try it. That's what I'd have done too. But if you were your own training client, you'd have settled on a specific program, I suspect, and probably do so when your clients have similar layoffs. Is it worth thinking through what that specific program would be for you, or what programming parameters you'd focus on? If so, and you had to do all over again, what? No reply required, et cetera, et cetera. He says he's grateful to us. Thank you for your remarks, William. I don't know, should I talk about this? I had a...
If you want to.
Yeah, because we know where it's going now. So I had a tonsillectomy. I had a bilateral tonsillectomy because I had one tonsil that was way, way, way bigger than it was supposed to be. And the reason was because there was cancer in that tonsil. I have lymphoma. And it looks like I may have gotten away with it. So we may have gotten it all. It looks probable that we did. And even if we didn't, I'm probably going to die of something else. So it's all good news. So you can just never mind, right? But anyway, it was kind of a big deal for a while. And I had both my tonsils whacked out. And in the 7th decade, that turns out to be real super happy fun time to have a tonsillectomy, a bilateral tonsillectomy. And I couldn't eat for a week, and I was in a lot of pain, and it sucked. And yeah, the way I dealt with that from a training perspective was I took off, I don't know, 3-4 sessions, something like that. And then I came in and I started lifting light, and I basically did my program. I didn't do an LP or anything like that. I didn't do a specific rehab program. I just came in like on, a heavy press light bench day and worked my way up to, something that I could manage. And it was like terribly light. And then I did, back offsets. I'm a big fan of back offsets. And then I did what I could until I got tired, and then I went home. Would I do that for a client? You know what I would do with a client? I would say, there's 2 ways we can go about this, right? We can just keep you on your regular heavy light medium or your regular 4-day split and see what you're able to do and not push it too hard, and you'll come back really quick. Mm-hmm. Or we could put you on an LP. We could take you back to a linear progression and do a novice LP.
Just simpler
for a while. Yeah. And that's called shared decision making, and it's a thing that we do here with our clients. So no, there wouldn't be any specific program.
I think part of that depends on the mental state that client is in. Like what they can handle. They might really...
A very individual thing.
They might really appreciate coming into the gym and just doing, what they consider basic stuff, simple things for a while, that if they're a more advanced lifter, if they haven't done in a while, it might be a nice respite from all the stress of the surgery.
When people are gone with medical issues, or even like really prolonged layoffs for vacations or life stressors or things like that, which obviously happens in a facility like this fairly frequently, a lot of times people will come back and they'll be back the first day and they'll pick up their board and it will just say diagnostic. And our lifters all know what that means, right? They're just going to get into the bar and we're going to find out, where are you at, right? And then we're going to have a conversation. We're going to engage in shared decision making. We're going to take it from there. And 2, 3, 4 months later, they'll get PRs. Yeah. That's just the way it goes, right? So you can come back. I got kind of a weird PR yesterday. You come back. So it's very individualized. We'll do an episode on it someday. Thanks for asking, William. You're up.
Next.
Yep.
Greg Bywater. I have scoliosis of the spine. Can I lift and not make it worse? That's actually an interesting way of putting that. Several of my clients have scoliosis.
Yep.
I'm sure several of yours do.
It's common.
Yeah. Mild scoliosis is a lot more common than I actually originally realized. All of them lift all the lifts. I don't think that I've ever made a modification to a program simply because of scoliosis. Have you?
Scoliosis is, as far as I know, in every case I've ever seen professionally in the gym or in the ER, it's established, it's fixed, right? Over time, it tends to degenerate a little bit as you get older, but it doesn't revert back to a normal spine. So if you have scoliosis, you have scoliosis. There are procedures, there are obviously surgical procedures, fairly invasive, involving hardware, where the spine can be relatively straightened. Those tend to be reserved for cases in which the scoliosis imposes some sort of physiological embarrassment, right? So for example, interfering with the work of breathing or some sort of circulatory problem or some sort of neurological problem, something like that. But just run-of-the-mill scoliosis, it's common. It's really, really common. And you adapt to it. You're able to do it. And I will bet you large sums of money that within the next few minutes, the words Lamar Gant will come out of Noah's mouth, because it's like his favorite example for this, and it's a good one.
Well, it is a good example. Lamar Gant, I think that he still holds the record for the person who has deadlifted the most weight relative to his body weight. I think that
tiny
still
man.
holds 130 pounds or something like that.
With a fairly marked scoliosis, not your average
beyond 90-degree bend at 405, I think. I think he had an X-ray one time at deadlifting 405, because that was the most weight. That was the most weight that he could stand still with and not move for the image. And I think that they said that his spine was at a 90-degree angle, and so they suspect that it was deflected a little bit more than that at, I don't know what his max was, 630, something like that. The point is that his back was weakened from his scoliosis. On the deviating side, it was a weaker back. And he made it a better situation for himself by encasing his compromised spine in as much muscle as he could possibly put on his frame. So that's what I would recommend. I will say that...
It's not a contraindication.
Right. I will say that I notice a bit more lower back rounding, slight rounding that I see as acceptable with someone that has scoliosis, because it's just more difficult to control that part of their back. We don't use it as an excuse. They still have to be hyper vigilant to set their back as well as they can. But you do tend to see a little bit of flexion as the bar breaks off the ground in those people. And that's fine. It's the best that they can do. And as long as they're doing the best that they can do, they're strengthening those muscles that, because of that deformity, don't work quite as efficiently as intended.
I think it underscores what we said with our previous question, right? The form just does not have to be perfect. Human beings are just not that delicate. This also raises the whole issue of kyphosis, right? So obviously in a population like ours, we have a lot of kyphotic clients. Kyphosis is the rounding of the upper back. And sometimes that rounding is most observable under a load, and sometimes it's observable even without a load. And again, it's not a contraindication to training. The training is good for you. I think that in both the case of scoliosis and kyphosis, if we had the data, if we were able to get the data and do longitudinal studies of people in a randomized controlled manner, what we would find is that training retarded progression in both kyphosis and scoliosis to more degeneration. But we don't know. That would just be my guess. But neither is a contraindication to training. So we take people with spinal abnormality and train them all the time. Our very oldest client is 95 years old, and he's extremely kyphotic. And he gets under the squat and he deadlifts heavy and doesn't stop him. So go get some.